So, hello, good afternoon, Ashish. Hope you are well. So,
Yes, ma'am. Good afternoon.
hearty congratulations on your great victory. Okay.
Thank you so much, ma'am.
First rank in both merit list, right? Common and AIMS, both merit lists you have
Yes,
done.
ma'am.
Okay.
Yes, ma'am.
So, how do you feel after
Uh,
such a time exam?
it is a great feeling, ma'am. It is a very happy moment for me and the family and friends all around.
Okay. So, do you hail from Chandigarh?
No, ma'am. I am from Ahmedabad, Gujarat. I did my
Okay.
MBBS from BJ Medical College, Ahmedabad, and
Okay.
then I did my MS General Surgery from PJ Chandigarh.
Okay. So now, are you into the final of MS, or have you finished it and now just studying for any set?
Ma'am, I just finished my MS in August this year, and
Okay.
after that, yeah, I was preparing for the exam.
Were you working somewhere in CTVS?
No, ma'am.
No. So you were just preparing for the exam.
Yes, yes, this was my first attempt. Actually, we were not eligible for the previous attempt because of the late admission of our batch.
Okay. Okay. So the last NEET exam also you didn't write. This is your first exam. You said
Yes, ma'am. Yes, ma'am.
it's the first exam. Okay. So how did the theory go? Was it completely your CTVS subject, or was there any other specialty questions or other general surgery core questions were there?
Ma'am, it was like 30 questions were from general surgery and the rest 50 questions from cardiothoracic vascular surgery part.
Okay. So did you get your exposure to CTVS during your MS times in PGI?
Yes, ma'am. Actually, I was not posted in CTVS per se, but I was interested, so I used to visit cardiac surgery OT whenever I used to get time.
Okay. So you were not given official posting in various specialties
Yeah,
training.
we were given postings, but I did not get CTVS posting actually.
Okay, okay, okay. So, did that exposure to cardiac surgery help with preparation of your exam?
Yes, ma'am, definitely.
Yeah, because I think in INISET, as opposite to NEET, they focus more on the subject, core subject. So,
Yes, ma'am.
it's very helpful if you have some practical experience or some
Yes, ma'am.
exposure to CTVS. Then it is very easy to understand and then write answers
Yes.
to the practical questions, practically oriented clinical questions. You were given
Yes,
more
ma'am.
of theory questions or clinical oriented questions?
Ma'am, it is like clinical oriented questions only. There were only few factual questions.
Okay.
Most of them were conceptual, like we can solve with conceptual understanding.
So how did you prepare for the part one?
Ma'am, actually, I was interested both in liver transplantation and cardiothoracic surgery.
Okay.
So I was confused which one to select. And towards the latter part of the form submission, I finally decided that I'll write for cardiothoracic surgery. So previously, I had prepared for both the specialties, GI surgery and cardiothoracic surgery. But proper CTVS studying I did for last 15 to 20 days only before the exam. And also, I touched on the important aspects of general surgery. That is also important to cover because it also carries like 30 questions and we cannot miss.
Yeah.
Uh, so, core cardiac surgery, everybody will be preparing, but that general surgery preparation will give the little bit of edge. And for cardiac surgery, I mainly referred to Marrow videos and I gave a 5 to 6 grand tests during those 15 to 20 days.
Okay. Okay.
Yes, ma'am.
So what did you feel after? Did you read any textbook or just you were preparing based on the videos?
I read certain topics only from the textbook, not in much depth, like certain images or few tables only.
Okay.
But mainly it was from the videos only.
Okay. So you saw all the recorded videos. I think there are 40 plus videos. So you
Yes, ma'am.
all the videos in cardiothoracic surgery.
Yes, ma'am. I saw all the videos and especially the revision modules. The last 5 to 6 videos are there with the MCQ discussion. That is very helpful for the last 2 to 3 days before exam because it covers up the entire subject
Okay.
comprehensively.
Okay, okay. So, were there any topics in the exam where you felt it would be better that we get more classes on that, or which the videos didn't cover like that? Did you feel any specific area was there where the videos were not focused on those?
No, ma'am, I was actually able to solve all the questions. I actually referred to my undergraduate preparation notes also of embryology and also the cardiology part of medicine, and
Okay.
cardiology part from pharmac as well. So the related subjects I read from my undergraduate notes, and also this videos of Marrow for CTVS I did,
Okay.
and I was able to solve all the questions. Only there was one question which was regarding the brand names of the valve. I was not able to
Oh,
attempt that one question only. Rest 79 I attempted.
okay. 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 And then how was the part two?
Part two was also properly conducted this time, ma'am. They had spotters. They were asking 5 to 7 spotters to everybody, and then they also want to assess the uh, temperament and the nature and confidence attitude of the candidate. That why do you want to pursue this branch, and what are your experiences that made you choose this? Also, they asked questions regarding one scientist, one instrument, one drug used in cardiothoracic or vascular surgery, and about one procedure, like that. They're asking 5 to 6 questions.
Okay. So we have actually conducted a second part training also in
Yes, ma'am.
Marrow. So did you attend that?
Yes, ma'am. I attended that.
Okay. So
That was
what's
also useful.
okay?
Yes.
Okay. Okay. So do you have any other friends preparing for this subject now? Your juniors, your friends. So what would be your
Ma'am, I'm actually very happy that the people who got rank 2 and rank 3 both are very good friends of mine. Dr.
okay?
Pratyusha is my batchmate from PGI Chandigarh only. She got AML 2. And Dr. Akshay Gajjar, he is my undergraduate batchmate. He got AML 3 and he then did his MS from AIMS Delhi. So
Okay.
it is very happy that we all got to rank 1, 2, and 3. And
Okay.
one of my juniors from PGI Chandigarh, he also got AML 6.
Oh, very good. Okay.
Yeah.
Okay. So what is your tip as a successful senior to your juniors who is preparing for the institute exam?
Uh, These institute exams are very much doable. You have to focus mainly on one subject along with your core specialty like general surgery. That all of us have prepared during our MS examination days. So we just need to brush up on those important topics, but it still needs to be done. We cannot leave it. And also the cardiothoracic surgery part, it is very well given in Marrow. Also, you should get the practical exposure of the branch. You should keep on attending the OTs and see how the surgeries are being conducted, how the patient is being put on the bypass, and what anesthetic preparations are being done, the transesophageal echo that they do, how various things are calculated, and although it is nice to have practical exposure also, and one should also read subjects in correlation, like basic subjects from MBBS should also be touched while preparing for the exam. That increases the understanding of our surgical part of cardiothoracic surgery. And also, ma'am, we had great exposure of vascular surgery at PGI in our general surgery department only. Dr. Ajay Savlania is there in our department. He is MCH vascular surgery. So I was posted with sir for almost 1 year, and we did lots of aortic work like thoraco-abdominal aortic aneurysms, and peripheral arterial disease management. So that pre or post op management, that exposure also helped a lot.
Okay, so that's very important that because super
Yes.
specialty exams have more of a practical oriented questions. It is very nice.
Yes.
At least we have at least 1 month of exposure to the core
Yes.
specialty that will increase your understanding of the subject very well. Because
Yes.
neurosurgery and cardiothoracic surgery are two specialties which usually have absolutely no connection with what you study in general surgery. Rest
Yes.
urology, gastro, plastic surgery, pediatric are all there are some connections, or you can just extrapolate, or we can understand. But these two specialties are, I think, a lot different from the general surgery. So it's very important that you get some exposure. So anyway, we are very proud of you, you, and convey my regards to your parents also, and
Yes,
wish
ma'am.
you all the very best in future. And whichever institute you choose, it's definite that you will get into that institute, and you continue your passion and your attitude like this. And I'm sure that you will be a very successful professional in future. And all the best wishes from me and our team.
Thank you so much, ma'am. Thank you
Thank
so
you.
much.